I'm Darrell Bigner, the director of the Preston Robert Tisch Brain Tumor Center, a highly regarded program that is the heart of Duke's neuro-oncology program. The center boasts many of the top leaders in neuro-oncology. It was first launched in the 1940s by Drs. Barnes Woodall and Guy Odom, some of the earliest pioneers in brain tumor research. Strong leadership and the commitment of every individual in the Brain Tumor Center led to its rapid growth over the years. With a staff of dedicated researchers, clinicians, social workers, and nurses, the center continues to make major advances in research and treatment of brain and spinal cord tumors. Since the Preston Robert Tisch Brain Tumor Center is a leader in brain tumor research, it receives nationwide attention. Our research and scientific discoveries are often the focus of media sources. For instance, in March 2015, 60 Minutes launched a two-segment piece entitled Killing Cancer, which followed brain cancer patients at Duke undergoing a clinical trial of a therapy that uses a genetically engineered poliovirus to kill cancer cells. The Preston Robert Tisch Brain Tumor Center has also received press coverage for treating celebrities like former Senator Ted Kennedy and American journalist Robert Novak. Furthermore, the neuro-oncology program's knack for implementing innovative therapies results in publications within high-impact medical journals in the field. I've been at Duke since 1963, except for 2 years I spent at the National Institutes of Health and a year as a postdoctoral fellow in Germany. I chose to come here because Duke has been an international leader in brain tumor research since 1937, when Dr. Barnes Woodall came here from Johns Hopkins and immediately began brain tumor research and clinical programs. At that time, neurosurgery and neuropathology were the only disciplines focused on brain tumors. Although Drs. Guy Odom and Barnes Woodall were talented neurosurgeons, surgery alone had little clinical impact on malignant brain tumor patients, and they died within months. So I decided to leave neurosurgery and enter neuropathology, where I could devote 100% of my time to research. Investigators here tried unconventional approaches that had never been done before, and I knew that Duke was going to be the mecca for finding progressive treatments for this deadly disease. Because of our cutting-edge research, today more than 66% of our adult patients and 75% of our pediatric patients are enrolled in clinical trials. With our aggressive approaches to curing cancer, people diagnosed with a brain tumor can now have hope for quality of life and ultimately survival. One of the most important decisions a brain tumor patient will make is deciding where to go for treatment. At Duke, we have a multidisciplinary team of experts made up of neurosurgeons, neuro-oncologists, radiation oncologists, other medical specialists, and nurses, physician's assistants, data managers, and clinical research coordinators who are all dedicated to the treatment of brain tumor patients. At Duke, patients are in a place where physicians understand all the subtleties of their disease and can offer customized treatment plans for each individual. I've spent my entire career here because I know that at Duke, patients come first and are given the best possible care. At Duke, we focus on a broad range of research in our laboratories. In 2014, we became the first brain tumor group to ever win the Team Science Award of the American Association for Cancer Research, which we received in recognition for the collaborative molecular genetic research we've done over many years with our colleague, Dr. Bert Vogelstein, and his group at Johns Hopkins, and for the immunotoxin research performed with Dr. Ira Preston at the National Institutes of Health, and for our genetically modified poliovirus research. Discoveries made from this research include the EGFR variant 3 deletion mutation and the first full exome sequencing of GBM, medulloblastoma, and other less common malignant brain tumors. We've been an international leader for decades in the development of peptide vaccines, dendritic cell vaccines, and other types of cell and antibody-based immunotherapy. One of our highest priorities is the design and execution of phase 1, 2, and 3 clinical trials with improved dose escalation methods for brain tumor patients. Examples of these innovative trials are our genetically modified poliovirus trials, immunotoxin trials, and peptide-based vaccine trials. The treatment options that are becoming available are the results of new technology, particularly genetic technology, and are unparalleled. We believe that regional tumor-targeted cytotoxic therapies, such as the oncolytic poliovirus and the D2C7 immunotoxin, not only specifically target and destroy tumor cells, but in the process initiate immune events that promote an in situ vaccine effect, which can be amplified by human checkpoint blockades to engender a long-term systemic immune response that effectively eliminates recurrent and disseminated GBM cells. Ultimately, both agents may be used together, providing two different antigenic targets and cytotoxicity mechanisms. We are finally starting to see success in treating these complex and deadly brain and spinal cord cancers, and are closer than ever to finding the cure. In over 50 years of research, I've never been more excited about the future of brain tumor research and treatment.